We've looked at a lot of compact bone when we looked at the osteons and the matrix here. So just to kind of review the difference between the compact bone and the spongy bone, compact bone has not only less space, as you can see, there's virtually no space, but there is a lot of matrix to give that strength and the compactness. Again, in the compact bone, in the osteon, it looks like tree rings, like you cut a tree and just looked right at the trunk of the tree and counted the rings. So that is called an osteon. The osteon also has the central canal in the middle. The central canal is also known as part of the Haversian system, and it's going to allow for blood vessels to come through and provide nourishment to the bone and the bone cells. It's got those tree rings, if you will, which are called lamellae. There can be 4 to 20 of them, concentric rings. We've got, again, the osteocytes in the lacunae, which in this image are the little dark spots, and then canaliculi that are connecting those osteocytes. I like this image of compact bone because I think it gives you an accurate depiction of how the layers of these concentric rings are aligned or set up to provide us with the most strength possible. Again, as I mentioned, there's this Haversian system in the osteon that's got that central canal in the middle, and these lamellae are basically these concentric rings that are around the central canal. These lamellae are weight-bearing, and they're in columns. So here's one within another, within another. And they're somewhat of a corkscrew arrangement. You can see the collagen fibers on this lamellae are going in this direction, whereas in this lamella, they're going in this direction, and in this lamella, they're going in yet a different direction. And so this gives you this kind of corkscrew type setup or shape with these collagens and collagen tubes in different directions. And this really helps deal with twisting force. It helps bone deal with a twisting force. Again, that central canal is going to have the blood vessels to provide the nutrients for the osteocytes. It also has nerves in it. So your bones have blood vessels and nerves, which means they're actually a pretty active tissue in terms of growth. And your bones are not stagnant once you become an adult. They are constantly changing, remodeling based on the physical stressors you put on them. So they need those blood vessels to get the nutrients to help with their constant remodeling and reshaping. There's something called Volkmann's canals or perforating canals, and these are some of the canals that are going to connect the central canals. You can kind of see them here. Essentially, they're going to connect. So this is one central canal to other regions of the bone to really help get those blood vessels and the nutrients that they carry throughout the bone into all the osteocytes. Again, lacunae, basically housing those osteocytes. And then the canaliculi are going to be the really small canals, hair-like even, that are going to connect lacuna to lacuna and to the central canal. We also have something known as interstitial lamellae. These are lamella that are going to be filling the irregular regions between the osteons so that there is no space. There's always going to be this nice, dense, weight-bearing lamellae that are going to help keep the compact bone strong.